Welcome to my YouTube channel. I have a special guest, Dr. Connie Widdowson, who is an OBGYN, who is here with us for our YouTube channel. Thank you, Dr. Connie Widdowson, for being here.
Thank you for having me. I'm very inexperienced on camera. This is my first ever YouTube participation, so forgive me for my inexperience.
Absolutely. And this is our first podcast as well. And we have some very common and important and interesting OBGYN, that is the women's health related topics that we both are going to discuss today. I hope this will be helpful to many of the women out here. Thank you for watching, and we'll get into the video. So the first as well as the common question that I have for Dr. Widdowson is, we have been seeing a lot of patients, especially in our clinic. It used to be they get their first periods or the menarche at the age of 13 or more, but nowadays we have been seeing younger girls between the age of 9 or 11 coming or reaching their pubertal changes and also getting their menarche at the earlier age. So we would like to ask Dr. Widdowson about what are all the recommendations that she can give for our patients.
I will be honest that oftentimes we don't see these patients. Our pediatric group is so robust, our family practice group is so robust, that I think you guys would be handling this a little bit more. But I do agree, we're seeing menarche sooner and sooner these days. 9 can be normal nowadays because our nutrition and our food sources are so rich that I think biologically speaking, the body is ready sooner. I understand the concern with that as a mom and a parent as well, and I think the key is a healthy lifestyle, healthy diet that starts young, that starts with us teaching them to maintain lower body mass indexes, to go ahead and just eat healthier foods, more fruits, more vegetables.
Right.
Exercise is key. Video games can be fun here and there, but outside sports, walking, those are huge lifestyle choices that I think we need to start at earlier ages.
Okay. Thank you so much for answering that question. So the huge is about the diet, because some of the kids they do not enjoy outside sports and mostly into the video game, and all those things we have seen them during and after COVID. So nowadays we give a lot of education and stress and importance about doing some outdoor activities or sports or engaging as a family together with the children, so that they can also incorporate that healthy diet as well as the lifestyle changes. The more we focus on their healthy diet, such as lean, mean protein and healthy fruits and vegetables, like how Dr. Widdowson has mentioned, the more we focus them on their exercises, their activities, as well as their diet, and they can reach the menarche at the regular age and not at a younger age. Thank you so much for that. And then we'll move on to the next question.
Absolutely.
The next one is the PCOS. I hear a lot about family, friends, patients, internet, everybody. We talk about the PCOS, and we see a lot of patients with the PCOS as well. Before, it used to be more of adulthood stage, I see PCOS, but nowadays we have been seeing even patients from 14 years to 17 years, less than 18 years, we have been seeing a lot of PCOS. So I wanted to ask Dr. Widdowson, the expert here, to what kind of recommendation that she offers for PCOS.
So PCOS sounds like a very scary disease. Polycystic ovarian syndrome is what it stands for. And many are shocked to find that it is actually a weight-related disease in the majority of cases. The cure for PCOS, surprisingly, is 10% or more of weight loss. Again, most patients aren't aware of that, and they're shocked to hear, what? This is a weight-related disease? So we're going to sound like broken records on this YouTube video, but healthy lifestyle is key. Exercise regularly, 5 days a week, 30 minutes a day. Changing your diet to incorporate more plants, if possible. Plant-based diets can't hurt. More protein if you are not completely into plant-based. That's the key. In terms of menstrual cycles, we do recommend that in patients who start skipping their cycles because of PCOS, at least a period once every 3 months, but you can always check in with your OBGYN provider, your primary care provider, on how best to achieve that. But the cure is very basic, weight loss, which is, I admit, the hardest thing for any of us to do.
Right. That's right. Yeah, thank you for reiterating that. So 10% weight loss can help with the PCOS. I know it sounds a little bit of like a polycystic ovarian syndrome, but it's definitely losing the weight of 10% can also be very helpful for you. As Dr. Widdowson mentioned, make sure at least 30 minutes of exercises 5 days a week, and also the healthy protein, healthy fruits and vegetables, incorporating that, and that can help you to reverse as well as help you as a treatment in the PCOS. And well said. And then the next question is about the pre-conception. I know when patients, when we see them before the conception, they can come for a counseling, and then especially when they are in a high risk, if they are pre-diabetic or if they are more prone to get into gestational diabetic, what kind of recommendations and what are the things that you anticipate for, and what kind of complications that you tell them that you can prevent with your diet and lifestyle changes?
Right. First and foremost, start a prenatal vitamin if you're even thinking of becoming pregnant. I actually tell my patients 3 to 6 plus months before you become pregnant. It cannot hurt, okay? In terms of high blood pressure, diabetes, of course, check in with your doctor first and foremost, because we do want to optimize your diabetes and high blood pressure control before you even become pregnant. In a perfect world, I would love to see hemoglobin A1Cs of 7 or less before conception.
Okay.
So that is key, and that is achieved through, healthy lifestyle. Again, I'm so sorry, we were saying the same things over and over. Other things as well, in terms of high blood pressure, is certain medications are safe in pregnancy, certain ones are not. So I would check in with your primary care physician, with your OBGYN ahead of time to make sure you're on the right regimen. But oftentimes too, once you get really healthy with your lifestyle, you can get off the medication before pregnancy, which would be ideal. So that's something else that I would look into before you conceive.
And can you also help us understand and what are all the complications that you explain to them, especially in terms of like if mother's diabetes is not well controlled? So what are the points that you add on?
With higher hemoglobin A1Cs, you can see more birth defects, which I don't think is talked about a lot. So that is why we recommend lower titer control. Okay, but those numbers you have to be higher for us to see that. But I think 7 or less is fantastic to aim for.
Okay.
High blood pressure and diabetes in pregnancy. Diabetes in pregnancy sometimes can lead to larger babies, which some people think is healthier. Why isn't a larger baby healthier? But you have to think about as well when baby, passes through the birth canal, delivery. Also, they're responding to your sugar environment. So if we don't set up the perfect house, so to speak, the perfect environment, they have to respond to that by making more insulin in their bodies, and that is not an ideal situation for the baby as well. So from that standpoint, we need to think about diabetes. From high blood pressure standpoint, if the blood pressure is not well controlled, I use this analogy, which isn't great, but you're the refrigerator that is feeding the baby with the placenta, and if that is not well controlled, baby's not going to grow very well. So these are very important things to optimize before we become pregnant.
Okay. Wow, that's a lot of information, but it's all very good information. So if someone's A1C or the blood glucose is not very well controlled, Dr. Widdowson has mentioned that it can cause some birth defects for them, and also because of there's called complications because of those large babies. So make sure that your diabetes as well as the blood glucose is very well controlled, so that our main goal is healthy mom as well as the healthy baby.
Absolutely.
So Dr. Widdowson, what kind of recommendations that you give? For example, if someone presents with the diabetes in your clinic and they're also pregnant, what are all the specific recommendations in terms of the diet and exercises you give it to them?
It is hard from a diabetes standpoint. We're all from different cultures and we all eat different foods. And when you're pregnant, why wouldn't you want to eat the stuff that that you love and that you grew up with? But I would say look into also different diets, different cultures, because of the fact that you can probably optimize lower carb diets. I will say in our Chinese culture, rice and noodle is huge. But with a diabetes diet, it's very hard, to eat that and have good sugar control. So more proteins, more lean meats, as you mentioned, and if you're vegetarian, very high protein foods, less carbs, decreasing by 50%. like say for instance you like 2 bowls of rice, 1 bowl of rice would
Okay.
be better.
Okay.
Roti instead of 2 or 3,
Okay.
just 1
Okay.
and a half.
Mm-hmm.
Okay, things like that. And then exercise. If you've eaten something that you know you're not supposed to eat,
Mm-hmm.
we all do it. Exercise for a little bit afterwards. It will drop your blood sugar a good amount.
Good amount. Okay, very good. So I want to say the same point again. So for anyone who has diabetes during their pregnancy, make sure to focus on low carbohydrate diet. I know it's tough because we also eat rice and there's a lot of carb in our diet. So at least cut down, make a goal of like cutting down the carbohydrates into half of it, cutting down to 50%, which also helps you to get to the goal. And also good amount of lean meat protein like white meat, egg or fish. Or if you're a vegetarian, you can take tofu, beans and lentils and legumes. That has also got a good amount of protein in that. And of course, focus on your high fiber diet as well. And also walking, Dr. Widdowson has mentioned, love to talk about that every day in our clinic and every day at home or with our friends as well. So walking helps a lot in terms of, so Dr. Connie Widdowson has mentioned and well said about how can we control the blood glucose, especially if you are in gestational diabetes or if you are trying to get pregnant. The most important thing is we have to cut down the carbohydrates into 50%, and that's the most important. And the second one is increase the lean protein in your diet, and especially if you're a meat eater, make sure to take lean meat, which is white meat, fish or eggs. And then if you're a vegetarian, make sure to eat tofu, beans, lentils, legumes, and lots of fresh fruits as well as the vegetables. That's also very helpful for you in order to maintain the blood glucose level, because we wanted to have a healthy mom as well as a healthy baby. So make sure cut down the carbohydrates, increase the protein, and also exercises after every meal, 30 minutes either after lunch or dinner, or even both the times. If you can walk 30 minutes after every meal, that'll also help you to maintain the blood glucose levels. Thank you so much for all of your advice and recommendations. And we are going to move on to the biggest topic here.
Yes.
The major transition that we all go through is the perimenopause and menopause, and it's a lot of talk about everywhere about that. And I wanted to hear from you about your thoughts about this major transition in women's life.
I'm happy that we're finally getting a lot more attention in this subject matter, because I think it was often overlooked in the past. It's a very real thing. We're all feeling it. And I will say, again, the happiest patients I have are the ones who first and foremost exercise. 5 days a week, 30 minutes a day, what we've talked about in the past. There are also resources out there on like a healthy menopause diet that you can look into as well. And then supplements, different supplements that you can try that are over-the-counter supplements, not necessarily anything that has to be prescribed by a physician. I will also say that if that doesn't work, then you can always just come in and discuss with us, with your primary care physician, with your OBGYN about next steps. But most of my patients are happy with just lifestyle changes to start with.
Okay, so very good, and thank you for reiterating again the diet as well as the lifestyle changes. And also, can you explain more into the treatment options for menopause, especially the hormones and non-hormonal options, and also the Women's Health Initiative? It took a big difference now. 18 years or 20 years ago, it has to be kind of like no hormones, especially for the increased risk of breast cancer as well as stroke as well as high blood pressure. But now 20 years later, they revisited that and they found out the hormonal therapy is also a good option for patients, especially during the menopause. And can you also explain that to us?
Yeah. So, there are, in my mind, 3 different ways to treat menopause. You can do healthy lifestyle changes, over-the-counter supplements, which is enough for some patients. There's non-hormone replacement medications that you can try, including surprisingly antidepressant medications or other medications that exist that will decrease hot flashes, night sweats. And I think the key to that is it decreases hot flashes, night sweats. It doesn't eliminate. The best treatment doesn't mean that it's the correct treatment, but what patients find the most relief from is hormone replacement. What Dr. Kazi basically alluded to is that before, hormones used to be voodoo. Nobody should take it because it's an increased risk to the patient. But what they found is with recent re-looking at the data, so to speak, that women anywhere in their mid-40s, I would say, to maybe even mid-50s would benefit from hormone therapy, even up to, I would say, as much as age 60. Beyond age 60, though, I'm not sure that there is as much benefit, but the hormone replacement can be something that could be even beneficial in terms of overall cardiovascular health, bone health. So it's something to look into. I'm not saying every patient should look into it, but definitely have a discussion with your doctor and see if it makes sense for you and your situation.
Okay. So the main options are the non-hormonal treatment options that she has very well explained to it, the diet, lifestyle changes, and there are also some other medications and supplements that is helpful for our symptoms. But we do have the options with the hormone replacement therapy that you can definitely talk with your provider for that. And now we have the 4 approved indications for the hormone therapy, the hot flashes, the genitourinary syndrome, and also someone who goes into early or the premature menopause. And then the 4th indication is like if someone who you expect that they can go into a bone loss or osteoporosis at a younger age, we can also replace them with the hormone replacement therapy. And then, so moving into the topic, I have one more question I wanted to ask you, Dr. Connie, about what are all the, especially for in order to prevent, what are all the steps that you can do for prevent for the bone loss for those patients? Can you also talk about the supplements that we can take, and also in terms of diet as well as the weight-bearing exercises?
So after menopause, the biggest thing, especially for those of us who are vertically challenged Asian descent, is that our bone health can be compromised. So the key is exercise, but more importantly, weight-bearing exercises. I'm not suggesting we go to the gym and become, live in the gym. As simple as just, 2 to 5 pound weights. Even just looking at exercises on YouTube, walking with heavy weighted vests, any of those things could help. In terms of supplements, I think maybe you would be better at addressing, because I know there's a lot of changes with calcium supplements these days on how much to take, but I would say, look, eat more calcium-rich foods.
Yes.
That's an easy thing to do, to try to help with overall bone health. But exercise, weight-bearing exercises included, is key to maintaining our bone health after menopause.
Very good, very good. Yes, it's very important how to maintain our bone health, because we want to prevent any falls at our elderly age, and that's the reason we wanted to make sure that we have a healthy bones. And also, as Dr. Widdowson mentioned, we focus now more on, rather than the supplements, if you can add more calcium in your diet, that is very well absorbed. And someone who cannot take much calcium in their diet, the supplements are also available. Definitely you can talk to your provider about the dosage of the vitamin D as well as the calcium. That will be very helpful for you. And also, she well said about the weight bearing exercises. When you're walking, make sure that you can lift some weight, like maybe a vest with some weight, or carry some water bottle, or probably 1 or 2 pounds of weight. So strength training and weight bearing exercises, which also will be very helpful for preventing of the bone loss here. Thank you so much, Dr. Connie Widdowson, for answering all of our questions. This is the whole range of women's health we talked about, starting from menarche, that the onset of the puberty, and also going into preconception, PCOS, as well as perimenopause, as well as the menopause. I think this is a whole summary that everyone who is watching here will be very helpful for you. Thank you so much for coming to our video, and thank you for being here for us.
Thank you for having me. This was fun. So I hope you guys learned a few things from us.
Yes. And make sure to leave on the comments if there are any interested topics or any other supplements that you try that has been helpful after watching this video. Make sure to leave that as a comment as well. Thank you for watching, and we will all hope to see you all in our next video.